Okay.
Yeah, that's really good. You look great for 95 years old.
95. That's right.
Whatever you are doing is working so well.
Well, I actually do. Dr. Riordan said, do not that I always, quote Dr. Riordan, but he was a pretty good teacher. And he said, don't ever recommend anything that you aren't willing to do yourself. And
Absolutely.
so I try to follow that.
Yes. So what about skydiving?
He didn't do that, and I don't recommend that. So I'm good. I think we're good. Have you done skydiving?
No, I mean, there was a time when I was younger that I really wanted to, but once I became a mother, all that went out the window. So, so I live in North Carolina, and I heard that there was a practitioner in North Carolina that was doing vitamin C IV, like right around the time, I think the Riordan Clinic started doing it. Is that correct?
Even earlier than that. I'm trying to think, hang on, I'm trying to think of his name. I'll think of it in just a minute here, and then we'll come up with it. But yeah, he was one of the first IVC practitioners. He used C orally. He used it as injection in kids. He did it IV. So he was really considered the clinical pioneer in. He actually treated 60 patients with polio and cured them with IV vitamin C before the vaccine came out. And most people said, why haven't we heard of him before? And it's just simply because vaccination, as you know, captivates people's attention. And it's not necessarily about health. It's about the quick fix. And people want a quick fix. And health is really about the slow gardening yourself towards a better state of well-being.
Speaking of vaccines, I know that vitamin C is great for detoxifying, but when people come into the clinic to detoxify, what else are they given?
Well, it depends on what you're trying to detoxify. If you're talking about heavy metals, then we do EDTA chelation. If you're talking about chronic autoimmune diseases, we use ultraviolet blood irradiation, and we'll use ozone type things. And so vitamin C is just, it's interesting. Vitamin C is also a methylating agent, and the methylation cycle, one of the results of it is glutathione. So it can help you renew glutathione within your body, which can act as a detoxifier.
I was going to ask you about glutathione, and because I couldn't remember exactly what that was. That helps.
It's made in every cell in your body, but it's made from a process called methylation. And if you're undermethylated, which most of us are these days, because there are so many toxic elements in the environment, in our food, in our clothing, everything, it's depleting glutathione. And so the methylation cycle is, there's three components to methylation, and the component that gives energy and neurotransmitter balance, the body, the biochemistry is pulling methyl groups away from that and directing it more towards detoxification. Hence, we have a lot of people that are tired and depressed and mentally not as with it as they would like to be.
Like the term oxidation versus how oxygen is good for you, how to obtain proper oxygen utilization for the mitochondria to get it to work as it should, yet avoid the oxidative stress or free radical damage in the cells. Just for a layperson, how would you address?
Well, free radicals are molecules that steal electrons, and they will steal an electron, and that in turn creates another free radical that is lacking an electron. Vitamin C is an electron donor. It's an antioxidant. Glutathione is an electron donor. It's an antioxidant. So there's this give and take in terms of having adequate amounts of electrons. Our healthy cells, when they have a full complement and they're functioning very well, there is relatively more cells that are what's called reduced or balanced, and there's less cells that are oxidized. But we need oxidation because that oxidation is kind of how fire burns. fire burns, and in the mitochondria, there is a process of oxidation occurring, but the body has it controlled. It's a controlled form of energy production, almost like a nuclear reactor. And when it gets out of balance and electrons start to leak, that creates oxidative stress within the cell. And that's why the mitochondria are so important as a source of energy for us. But if that is not controlled properly by very powerful antioxidants such as vitamin C, and now we're learning melatonin is an intracellular antioxidant. Melatonin, the whole melatonin story is very fascinating because most people think of it as just a sleep aid that's only made at night. It's only made during the night by our pineal gland, but during 24 hours a day, our cells and our mitochondria are making melatonin as a way of balancing this oxidative reduction process, that if it gets out of control and you get too much oxidation, that's where you get injury, inflammation, aging, damaging, those kinds of things. And so, I've spent a lot of time talking and reading and trying to learn about mitochondria, but it's almost beyond, I mean, it's really a highly specific, scientific discussion, only to know that mitochondria, I think by and large, we're having failure of mitochondria because of so much oxidative stress in the modern world. And so a lot of people they're not getting enough sleep. That's a time when your body recharges and detoxifies, and people are not getting enough sleep. We have the whole blue light issue. We have GMO foods. These are, there's a lot of disruption of membranes going on, and mitochondrial membranes are a very important part of maintaining the health of this energy production process that we need. They generate ATP, which is the energy currency of the body. And once you, for example, cancer cells, what's happened to them is that they've shifted from oxidative phosphorylation, which is what mitochondria does, back to a process of where they're fermenting glycolysis. And in fermentation, one molecule of glucose will only give you 2 ATPs, but in the normal way that our cells make energy from glucose, you get 34 to 36 ATPs. So cancer patients, the reason they crave sugar is because their cells have shifted back to this inferior form of metabolism, and in order to survive, they create more and more glucose transporters on their cell membranes, and they crave sugar. This is why, a lot of your cancer patients, they lose their appetite, but they'll eat sugar as much as they can because they're so tired and they like the taste of sugar, and their cancer cells are actually craving sugar. And this is why the PET scan, when you go in, if you happen to have cancer and they want to check and see where are the tumors growing, they'll give you an infusion of radioactive tagged sugar, which is taken up by the cancer cells because they have gone back to this more primitive style of functioning of just burning sugar without oxygen. So this comes back to your original question, like, what's this oxygen thing going on here? Cancer cells are lacking oxygen, and they're basically regressing back to a more primitive form of metabolism in order to survive. So these are cells that are just trying to survive because they've been injured within the modern environment that we live within. And we're finding out that cancer is now being understood as a metabolic disorder. It's not a tumor growing. Yes, it is a tumor growing, but it's the failure of normal metabolism in certain areas of the body that have been injured that causes these cells to regress to a more primitive style of functioning, where they are not functioning as part of the family, as part of the whole organism. They're starting to work as if they were independent organisms, and they're trying to grow and survive on their own. And so when we send chemotherapy and try to kill the cells, yes, we can kill cancer cells, but very often what happens is you get a survival of the fittest response. And then that's why eventually the tumor starts to regrow again. And that's why after a while, none of the chemotherapeutic agents work. and the oncologists keep using stronger and harsher chemicals, and the poor cancer patient is just beat up. And if they were exhausted before, then they start to lose hope, and they get into a horrible pain state. They lose their appetites, and that's called cachexis. And they just start to really, their life just goes out of them. And that's why the whole cancer thing is really a manifestation of our misunderstanding of what health is and the importance of oxygen. We need to look at the fact that aerobic exercise, aerobic breathing, various forms of oxygen, and most of the therapies, like if you take ozone, that's an oxygen therapy.
And so is it when I saw a list of therapies at your clinic, is it prolozone? Is that how you pronounce it?
So prolozone is a very good illustration. Yes, prolozone is where we're injecting ozone into, let's say someone's got an inflamed knee. And so normally they'd go in and have an orthopedic doctor inject cortisone in their knee. And cortisone just basically shuts down inflammation, but it doesn't promote healing. It actually promotes degeneration. But when you inject ozone into the knee, it reboots the healing process. And the reason it does this is that ozone is basically oxygen. We make ozone within minutes before we inject it through a special machine that basically sends medical grade oxygen, O2, through an electrical field, which causes several of the O2s to break apart. And then you have a number of these high energy O1s that are going to go ahead and react with an O2 and form O3. And that's what ozone is. It's an O3 molecule that's highly reactive, almost like hydrogen peroxide in a gas form. And then when we inject that into a person's knee, it actually, for one thing, it disinfects any possible infection that's in there, cleans that out. But it also sends a very strong signal to the immune system to send in the inflammatory cells. And you say, well, wait a minute, I thought we were trying to get rid of inflammation. Well, you disinfect the knee, because there's a lot of people that believe that that if you have chronic arthritis in your knee, you probably have low-grade infection in the knee. And so this disinfects it, but it doesn't remain as an agent that's going to trigger additional long-term inflammation. It actually causes the body to send all of the white blood cells there to clean it up. And then it also brings in the fibroblasts, the osteoblasts, the chondroblasts, all these cells that do repair work. Mm-hmm. And so ozone injections actually initiates a reboot. The knee will start to heal itself and regenerate. So oxygen acts as a regenerative agent. So we're using that in hyperbaric oxygen. We're using it in a number of different ways. So
do you have hyperbaric chambers at the clinic?
We have one that unfortunately at this time is not functioning. We've used it in the past. We're talking about possibly opening, putting in a number of hyperbaric oxygen chambers, because they're pretty expensive, and you need it. If you get a really good one, you need operators. And so you have to hire operators. But there is a form of hyperbaric oxygen where you can buy a unit. You can actually buy it for yourself at home. We're thinking about creating an area of the clinic where we have 2 or 3 where people can basically run the hyperbaric oxygen themselves. And it's just that these units are $8,000 or $9,000 a piece. And so we have to create a business model where they can come in and spend so much time and come back periodically. But that is another important modality of healing, using oxygen as a therapy.
I would love to try that. I was wondering if have you heard of anyone doing some kind of documentary where somebody gets put through sort of like an anti-aging protocol from start to finish? I would love to volunteer for science in this case.
Well, it's, Dave Asprey, he's really into all this stuff. If he looks at all these, what he calls biohacks, as ways of slowing down the aging process and helping people to, elicit a regenerative response within the body.
Right.
And he's actually forming, people are joining, they're like clubs where they can go in, they can do hyperbaric oxygen, they can do intravenous vitamin C, they do red light therapy. There's actually lots of these therapies that are not just for sick people, they're for people who are healthy but want to slow the aging process or enhance their overall sense of well-being.
Right. What would be the category of client, a patient that walks into the clinic the most depleted or the most in need of your services? And an inquiring mind of an advanced maternal age mother is asking.
So, we have a lot of patients who come in with things like Lyme disease or chronic fatigue syndrome. I've been at the Riordan Clinic for 31 years, and probably the most common chronic condition that I was dealing with early on was fibromyalgia. And if you've ever heard of fibromyalgia, it's where you have fatigue, you have pain, you have an intolerance to smells and environmental chemicals, and you can't sleep, you're depressed. You can have as many as 20, 30, 40 different chronic symptoms. And so what we found is that there weren't, a lot of doctors, what they try to do is give it a name, and then here's your drug to treat the name. And fibromyalgia it didn't work. They eventually did create some drugs, but most of the time what drugs do is they basically treat the symptom or one of the symptoms, but they don't really correct the underlying causes. And so when I gave my talks on fibromyalgia, I basically told people our job is to look for hormonal factors, toxicity factors, infectious disease factors, sleep problems, poor quality food, relationship issues, stress management issues, lack of exercise, loss of strength. Basically, you have to kind of initiate a wholesale lifestyle revision or makeover in order to really, truly get well. But one of the big things I found was thyroid dysfunction. And it was types of thyroid disorders that conventional medicine was totally missing. And so we had to add some additional tests like the reverse T3, which you can go in and get a TSH, you can get a T3 level. And if those look normal, the doctor says, well, you don't have thyroid problems. But we found a lot of people, what they had was their chronic infection or their chronic inflammation was actually triggering a response in the body where the cells started to generate a molecule called reverse T3, which was diametrically opposed to the T3 that they had. The net result being is that they were in a functionally low thyroid state. And when you look up at the symptoms of low thyroid, it's everything that I just now told you. Their skin is dry, they can't sleep, they have irritable bowel, they had multiple system symptoms, and most doctors just brush them off. You're just depressed, or you're crazy, or we don't want to see you. So we ended up seeing a lot of patients who had been frustrated trying to go through the standard medical routine with their regular doctors. And so that's a big part of my early days at the Riordan Clinic. And I was pretty good at this because my wife had fibromyalgia. And so she always sometimes says, yeah, I was my husband's first real patient that he could learn on, and so I'm happy to say she also had methylation disorders, she had thyroid disorders, and I'm happy to say that, here it is 31 years later, and she's well, she's teaching, this may be her last year of teaching. She survived breast cancer as a result of using IV vitamin C. Ah. And so anyway, I am always very happy to share what I know, because I know there are so many people out there that are looking for answers, and they're not wanting to just be put on symptom control pharmaceuticals. They would really like to correct the underlying cause of their illness. And this is what Dr. Riordan championed at the Riordan Clinic.
Absolutely. Do you train practitioners, or how do you personally deal with the emotional side of the job when you have so many patients who have a negative energy and you're working with them one-on-one? How does that work? How do you survive that?
Well, one of Dr. Riordan's, I think one of his great contributions was the concept of co-learning. That when I see a new patient, I'm not there to fix them. Like a lot of doctors feel it's their responsibility to make everything well. I'm there to learn with them in terms of what are the unique things that's going on in their life, in their upbringing, their understanding of health, their biochemistry, their nutritional factors, all these different components that go into building health. We just start to explore those. And the big thing that we do at the Riordan Clinic is we do this, it's called the Real Health Discovery Profile. And we look at all the nutrient levels, the hormone levels, we look at methylation factors, toxicity factors. And so these are numbers that we can look at together and start to quantify where the issues are. And from that, we can make a game plan. And once people have a plan and they understand that this is just not all in my head, that I really do have biological factors that are pulling me down, they feel hopeful. They feel like I've got a direction. And the treatments we use tend to make people feel better. A lot of drugs, they mask symptoms, but they also have side effects and make you tend to feel worse. And so this approach is a health building approach. And I try to get that synergism between myself and the patient working, where they feel like I'm on their side. I understand that what's going on with them. I've been there before with other patients, and we can find a way to help them restore their health.
Wonderful. Right. That's just so great. The co-learner experience.
Yeah.
And how many square feet is the clinic or the property? The
property is 93 acres. It's fairly large. We are in the process now of developing it. We would like to make it into a campus of like-minded practitioners. The medical model is really a pretty narrow way of looking at building health. For example, I work, I do, it's not bodybuilding. There's an organization called the Exercise Coach, where they have machines that are very precise and you can see exactly how much you're lifting each time. And each time I try to do about 2% more. And so it's a way of building strength, but not so much to build muscles, but to maintain strength and to develop a better sense of well-being and health. And so that would be an example of a company that we would love to have in our site. We would love to have a farm-to-table restaurant.
Wow.
We would love to have maybe a health food type of store where people could go in and not just look at shelves and shelves of vitamins, but they could get training in how certain nutrients work and what matches their symptoms type of thing. And so and then you get into lots of body work types of things. This is actually what Dave Asprey's trying to do with his model of a place where people go to improve their overall sense of well-being. And then that ties into regenerative medicine, anti-aging medicine, those types of approaches.
Yes, I've always dreamed of having, some sort of health venue, store, restaurant, something, but always attaching an area for children. And so the mothers can mothers are big shoppers, they
Yeah.
do the groceries. They have to take care of themselves. They have to make sure their kids don't get sick. So, a place that's very mom and kid friendly, a place you can just go and be safe with children. Absolutely. I would always include that in the
good thought. Yeah, that's a good thought. And probably we unfortunately we probably should try to see more busy, tired moms because I know that's an issue. We have 4 children, and one of our kids, number 2, Anne, she has worked with us for 7 years as a chiropractor. But she's now not working with us because number 4 child came along, And so she's had a career change, and, and this is all part of the life journey.
Right. Well, I have a toddler now. I have an 11-and-a-half-year-old son, and I haven't slept through the night in a year and a half.
Yeah.
And I'm wondering, what should I do? I feel like I look okay because I'm young, but underneath, like, a lot of stuff is getting depleted. So I would love to, get some advice on maybe the top 3 things I should do. And I'm taking some vitamins and I know how to eat. So.
Well, I'll go ahead and give you my top 3 right now, because the last thing you want, these kids want, or your husband wants, or I would want for you, is to pick up COVID. COVID is out there, and obviously your age, I'm actually in the so-called high risk area. But one of the things that people don't realize is that there are now 150 studies specifically looking at how vitamin D helps to either prevent or treat COVID. So vitamin D, as much as I love to talk about vitamin C, vitamin D is really not a vitamin. It's really a hormone that we all need, and that does hundreds and hundreds of different powerful things within the body. And our ancestors used to get it because we were outdoors a lot more. Our culture we're an indoor culture. We're moving into the winter months here in the United States. And so consequently, what little vitamin D we would get from the sun, we really can't get that during the winter months. Even if you do live in an area that has more sunshine, the angle that the sun comes in, when it hits the skin, it doesn't really generate that much vitamin D. So one of the first things I like to be sure people have measured, I would encourage you to get a vitamin D level at some point. But if you don't, you should at least be taking 5,000 units of vitamin D. And then I always encourage vitamin K2, because vitamin D, you can go higher than 5,000, and typically we do. We use our measurement to kind of help us make that decision. But if people want to take 10,000, then I'll make sure they're taking vitamin K2. Vitamin K prevents excessive absorption of calcium, because that's really the only side effect that high levels of vitamin D can have. A lot of doctors are afraid of vitamin D because they've heard that high levels does something bad, but they don't know. If you have to ask, what does it do bad, doctor? And they'll say, well, I don't know, but that's the American Academy of such and such says that you really don't need more than about 2,000 units a day at the maximum. And in reality, there's a lot more new research showing that high levels help the immune system and is one of the best ways to prevent COVID. And if you're worried about taking too much, vitamin K2, our ancestors were by and large agricultural, and during the summer months, they would be outdoors working and getting lots of vitamin D. A lifeguard spending an afternoon on the lifeguard chair will make 50,000 units of vitamin D. So, but we don't worry about them, but nevertheless, the reason, and they can get into problems. There have been reports of lifeguards having kidney stones because the high amount of vitamin D will cause them to absorb more calcium, and too much calcium could come out as a kidney stone. Right. But the reason our ancestors didn't have that problem is because they were agricultural. They lived on the farm. They had milk cows, and the milk cows ate the green pasture grass, which contains the chlorophyll, which in their digestive system was converted to vitamin K2. We can make our own K1 in our digestive system, but we can't make K2. Our K1 regulates coagulation, but K2 regulates calcification. And so if you have a good level of K2, all your extra calcium you pull in with the higher levels of vitamin D will go to your bones and to your teeth. And so there's really no danger with the higher levels. And at the same time, the higher levels will help you sleep better. They help your immune system. There's actually a beautiful website called Vitamin D Wiki, like an encyclopedia of vitamin D. It has over 125 conditions that vitamin D will help improve. Okay. And then it links to all of the research. Like, for example, COVID-19 now has 150 different studies that have been done in the last 10 months. And you click on vitamin D on the COVID, it'll take you to a list of these different studies, and then you can click on those, and it brings you to the actual study and graphics and whatnot. So it's not some talking head telling you what you should know about vitamin D. It's where you can explore this on your own. We have a lot of people presenting, like even myself, a lot of people will say, well, you're just talking, doctor. How can we trust you? You're just a talking head. And we have lots of talking heads on the news media that are scientists.
Right.
I really encourage people to, if they can, to look up this stuff for themselves, to be their own basis of learning, because not everyone has your best interest at heart. There is so much deceit in the world today under the heading of science, because a lot of science now is owned by the pharmaceutical industry. It's owned by a number of profiteering organizations. And so I encourage people to learn how to interpret science a little bit more on their own and not depend upon just experts. And so that's why Dr. Riordan was big on co-learning. He wanted each person to become independently knowledgeable about their own health and how they could search out reasonable ways to build their health without necessarily spending a fortune or, taking a lot of medications in order to treat symptoms.
Somebody else was quoted as saying the Institute of Health had once talked about how vitamin C was great at preventing, or just great to guard against viruses. But I kind of wonder why we don't see any of that anymore on the news, anything as far as natural immunity.
You don't hear anything about vitamins. You don't hear anything about vitamin D. The only one thing I've heard recently is one of the health ministers in Britain who started reading all this research on vitamin D said, wait a minute, this is very inexpensive. It's extremely safe. We can get it out to the public, to the vulnerable very quickly at a low cost, and they'll have a number of other side benefits while they take it. Why are we waiting for this vaccine, which is going to take months and months and months to really reap the benefits? Whereas with vitamin D, once you start getting your blood level up, see, a lot of the people that I see, if they're not taking vitamin D, their blood level will be around 7 to 15. It's a very low level. Most doctors try to get their patients above 20 to 40 is where they are happy with. We try to shoot for like 60 to 80 along with the K2. And I have patients that are actually at higher levels than that, and we monitor them to make sure that they stay safe. But anyway, this health minister got it passed through the British Parliament or whoever. They sent out vitamin D supplements to every nursing home so that every nursing home resident in the country of England is now taking vitamin D. I don't know what dose they decided on, but any is better than none. Yet the pharmaceutical industry, which is in control of the news media, you really don't get a chance to hear much about vitamins or the nutritional studies that have been done, because they say it's unproven. And there's a lot of things that they're doing now that are really unproven, that could be done on that are being done, and it's not really controlling the epidemic. And so anyway, I kind of feel bad, because I feel like I have knowledge that could be very useful. Back to your question, vitamin D, vitamin C, and zinc would probably be the three main nutrients that are going to be of help to you. Zinc, because it stops the RNA polymerase enzyme inside of the virus, inside of the cell that's been invaded by the virus. So that's what replicates the virus. So if you can stop the replication of the virus, you can stop the progression of the illness. We now know that quercetin will improve the absorption of zinc into the cells. So we usually recommend quercetin along with zinc if that's available to him. So there's a number of things that people can do on their own to help them get over one of these infections.
I became knowledgeable of the liposomal vitamins back when we started discovering the Riordan Clinic. So I need to get back into taking that. That's a good tip.
Yeah, that's one of the limitations of regular vitamin C. The gut has to actively transport it across the GI membrane, and that requires energy. And so most vitamin C pills, only about 30% gets absorbed. And if you take too much too fast, you end up with diarrhea. That doesn't tend to happen with the liposomal vitamin C. There are also some other forms of vitamin C now that contain factors that increase ATP production, and so then these transport cells can get more vitamin C across faster. So there's some interesting new technologies in terms of using oral vitamin C.
Why don't we produce vitamin C? Which vitamins, what do we produce naturally, and why don't we produce vitamin C any longer?
Every creature except humans, primates, and guinea pigs, certain fruit-eating bats, make their own vitamin C. Humans and certain primates. Humans, we have the genetics, but we can't make the enzyme. The enzyme is the lactone oxidase enzyme that converts glucose into vitamin C. And every creature can do that, some better than others. Goats are fantastic at doing that, and they can take their daily 2,000 milligrams a day that they make and jump it up to 15 to 20,000 if they're really seriously ill. So I've often told people that is nature's equivalent of giving IV vitamin C. We give IV vitamin C 15, 25,000. And so it's what nature can do in an animal that retains that genetic ability to make their own vitamin C. So we have to take it, we have to get it in the diet, or we can take it as a supplement, or we can get it IV.
Can you drip any vitamin? I'm assuming no.
You can drip. The B vitamins drip really well. Vitamin C it's very safe if used. It has to be used properly, but it's generally very safe. The fat soluble vitamins you cannot do that way. And so D, E, A, and K, those have to be taken orally. Your minerals, you have to be a little bit careful, but you can do IV minerals.
Okay.
So yeah.
Well, I have a couple more questions. I wish I could go to the clinic, but would you ever do something like people at home take their own urine, blood, saliva, and mail it in? Has that ever happened?
Yeah, we do have. We've got one test that we've definitely recommended people that they can do, is called a urine Pyrroles test. And Dr. Riordan was one of the early pioneers in making use of this test. Remember, at the beginning of the show, we were talking about oxidative stress. And it turns out that the urine Pyrroles is a measurement for oxidative stress. And so if you have a high Pyrroles, then we think it's related to poor methylation. And so the two things that we give people if their Pyrroles are elevated is zinc and B6. And that will bring the Pyrroles down. Patients will find that they feel better, they're less anxious, they're able to make better decisions in their life. So that's a simple urine test. The other thing that we sell in our little store is Vitacek C Strips. And so this is a little jar of 50 strips, and at the bottom of each plastic strip is a little pad that's impregnated with chemicals, and you run it through the urine stream while you're urinating. You run it through the stream to catch some of your own urine. Wait 30 seconds, and on the bottle, there's a little color code, 5 different colors that tell you what % saturation there is in your urine. So it's a way of monitoring your own urine to see if you're taking enough vitamin C to where it fully saturates in your urine. And so that's a nice self-care test that you could do.
Yeah, that's a great idea. And a couple more questions. I was just wondering, what's your stance on coffee, drinking coffee? Do you drink coffee?
Yeah, coffee is one of the highest sources of antioxidants in the American diet. Some people, then you would say, well, I should just drink a whole lot, but too much caffeine, you can get into problems with too much caffeine. But I think using coffee in moderation is really a very healthy thing to do. The problem is a lot of people put the wrong kinds of things in their coffee. They put too much sugar in their coffee, and this is a problem. Or they'll put the wrong kinds of creamers in. These artificial creamers are not good. Right. And so actually Dave Asprey does the Bulletproof Coffee, where he'll add MCT oil
right.
or butter. And so for a lot of people, that keeps you in a ketogenic state. So you can have the Bulletproof Coffee, or you can have even just black coffee, and have that for breakfast. It's really not a breakfast, but that allows you to stay in ketosis from the evening before. Let's say you finish eating at 7 o'clock, you can go all the way to noon, about 18 hours of fasting, and that's what's called intermittent fasting. And the value of doing that is that you're basically, most Americans, they eat frequently throughout the day, and if they don't, they get low blood sugar episodes because their body has shifted more into sugar burning. And really the healthier way to live is to be a fat burner. And then you wouldn't have so much trouble with weight, and you would have more sustained energy. And the way to retrain your body is to do intermittent fasting, to where you'll have like 17 or 18 hours of no carbohydrates, and generally speaking, no food. Maybe the coffee would be okay with no sugar. And that would allow you to, over time, regenerate your ability to burn fat and to activate your mitochondria.
Well, we must have mitochondria wellness. I'm a big believer now. I want to keep studying it. That's really, really interesting. I love to hear people's perspective on coffee, because it definitely has been so controversial for wellness seekers. So,
well, Dave, another thing, Dave, I don't know how big of a deal it is, but a lot of coffee has mold in it. So there are some people that they drink certain types of coffee and they don't feel well. But if you can get a high quality mold-free coffee, I think it's a plus, a lot more of a plus than it is a minus.
Yeah, I sense the dehydration when I drink coffee, and I'm obsessed with pure water. I'm just a water purist, and so I'm sensitive to that.
But as long as you're paying attention to that and have your 1 or 2 glasses of water with your coffee, you're probably fine.
Yes, and I'm definitely taking my ascorbic acid in my water, which I had recently learned that it's good to keep taking the vitamin C throughout the day, whereas before I didn't realize that I wasn't all set to go if I had it in the morning.
Vitamin C, normal vitamin C only has about a 3 to 4 hour time frame in your body, and so in order to maintain a decent blood level, you probably have to take it three or 4 times a day, unless there are now long-acting forms of vitamin C that you can also take that would work.
I should have asked you this earlier, because this is important. I know you talk about this a lot, but in a nutshell, can you talk about the difference between vitamin C IV and oral vitamin C when it comes to combating disease or cancer?
Yeah, it's pretty simple. If we were to measure, Ellie, your vitamin C level and my vitamin C level right now, we would both be somewhere around 1 to 2 milligrams per deciliter. After a 15-gram IV vitamin C, which is a small one, that's going to go up to 100 milligrams per deciliter. So we get 100 times the amount of vitamin C in our blood after a 15-gram vitamin C. In our cancer care, Dr. Riordan did the research on 60 different types of cancer cells, and he found that you have to get the blood level up to about 300, 350, maybe even 400. So that takes about a 50-gram IV vitamin C given over about 90 minutes in order to get your blood level that high to where it has cancer-killing effects. So that's why the IV vitamin C plays heavily in the Riordan IVC protocol for cancer care. It's an adjunctive protocol. We're not trying to. People can be doing conventional therapy along with IV vitamin C, and there's actually the worldwide research on vitamin C is vast, and there's really good quality of life studies and studies indicating that vitamin C does not interfere with the vast majority of conventional oncology treatments.
It may help the whole situation.
Fewer side effects.
Absolutely. And last but not least, now who would you like to see play you in the film version of your life?
Who would I like to see play? Me. I don't know. That's a really good question. I've always been an admirer of John F. Kennedy, but I don't know enough about him to know. That's interesting. If you seriously ask people, would you be willing to live in someone else's life? Most people wouldn't. I know it's an interesting question to think about, but
yeah,
Harrison Ford might be my next guy because my wife loves Harrison Ford, and I always feel a little jealous about him because. But he's
who would play her? Who would play the leading lady?
Oh man, now you've got these are tough questions because I'm not that much in a. Who would play the leading lady? You can tell I'm not that much of a movie guy. I don't know. You.
Oh, thank you. That's my background is acting, actually. That question was from John Jacoboski. He says hello.
Oh, John. Hi, John.
And he wanted to ask if you were still doing 12,000 milligrams of vitamin C. I think he had heard that years ago or maybe recently.
I usually take 16,000 a day. So I try to keep it up as much as my gut will allow me to have. So, but that's about.
I'm telling you, you look amazing for 95. Really,
I'm not waiting. I'm not 95.
I know. I'm just joking.
Almost 70 though, so it's I'm getting there. So I'm trying to maintain somewhat of a youthful.
Yeah. Oh my gosh. Yes. Well, you're in the right business for sure.
Well, thank you. I really appreciate being on your show, and I'm sorry if I got a little bit too long-winded and too technical for people.
Not at all. I have so many more questions, but I have to call it quits because there's a toddler somewhere nearby. So,
yeah.
But thank you so much for helping educate.
Mama. Yeah, you got to do your job.
Yes, and I'll keep my vitamins high too, so I can fill my cup, so I can fill everything.
All right. Well, you look great. You look great for a young mom. You're doing great. So keep up the good work. 30. If you don't do it, no one else is going to do it for you. So you gotta take care of number one. So.
Yeah, absolutely. Well, thank you for taking care of so many people and educating so many people along your journey. It's all very inspiring.
Well, thank you so much.
I'll be in touch.
Okay, you bet.
Thanks so much. Okay.
Bye-bye.
Bye.